gorgeous patient. I'm very excited. I've never treated her before, but I'm excited because she's super beautiful. And most women coming in, I find nowadays are getting overdone looks and they're getting too much done. She hasn't had much done at all, but it's allowing us to contour her and get some lifting for her without her looking overdone. She has naturally her under eyes, mid face, and around the mouth are kind of coming down, and she has less lack of contour on her lateral cheek. So my focus is going to be her mid face and also tightening her lower face. First step with filler, second step with threads. But in the first step, when we use a filler, we're also going to use a mesh, which is made of PDO, builds collagen, and holds that filler in place. So first step is we're going to do a little to improve both the under eye and the lateral cheek. Now, what she really wants is more contour. And again, what I always tell people is the under eye really doesn't need a lot of filler if you do lifting and contouring of the cheek. And so with her, we're gonna go on a high arch because it really fits her facial shape, and we'll give her more of a heart-shaped look, but more contoured. And you guys can see already with just a little bit of filler, it's not much, it's lifting and it's improving the overall look of her mid-face and lateral cheek, because I want her, once we do the threads, you guys could see like already this is elevated now and that area has improved. So that's very little. I'm going to do that on the opposite side.
Dr. Emer, does combining multiple treatments like filler and threads make the downtime longer, or is
It depends. Like filler and threads is the same, but if you're doing with laser, there may be more downtime. In general, it depends. But I would say if you're going to get filler and threads on the same day, it's probably a good idea, because if there's any swelling, the swelling goes away at the same time. You know, that's why a lot of people will do Botox, threads, filler. And so I'm going to do that same thing here. Now, look what I'm trying to do. I'm focusing on giving her more contour that tapers off and kind of gives her height. But with her facial shape and ethnicity, we really want to heighten it through the mid face to lateral part of the brow, and a little bit even into the cheek under eye junction. Not necessarily the tear trough, but it's enough to like really give her support to her under eye. And if you go laterally and high enough, it gives you like a foundation here that holds the cheek up. So even without the threads, she already has more contour and improvement in her folds. It's pretty impressive. Now what I'm going to do secondarily is now focus on her folds. And hold on, I'll show you guys here in a second. Gotta get it primed. There we go. And so what we're gonna do is we're gonna insert this PDO. You guys see that here, a little bit of filler. You guys can see it there. The goal is to get this thread into there, and look up with your chin and look left. This should not hurt at all. So we're going to, again, go in there with our filler and thread and just kind of contour the fold. Now this will allow us to put filler into the right location and build some collagen long term. So the thread gets inserted. Now what I like to do is do that first, which is what I just did in the deep volumization. So we're doing deep volumization right now. Hold on. Okay, hold on. And did that hurt at all or no?
No.
Good. That makes me happy. Let me prime this one. Hold on.
The best numbing.
Best numbing and best hands. It's all about the hands. Oh, I can't get this one. Hold on. Give me a sec. Okay, there we go. Okay, number 2, we're going to do that same thing. And again, it's going to feel kind of weird, but it's not. It shouldn't really hurt too much. Again, we're right into the fold where I want it to be. Deep. This is the deeper fold. And again, we're just using a fine filler. Now you could use thicker fillers like radius, things like that. She doesn't really need that. She needs softening. Her face is not something that needs like aggressive, thick. We want her to look smooth and natural. And so just wipe her off there. Now I'm going to go back and Let me switch to here. Now what I like to do is layer a little bit on top. What I do is, now look, you can see that height is great, is soften. So with here, now I'm using Refine very superficially in blebs to fill this triangle here. Because this triangle is where she has a little bit more of the deficiency, and it will look a lot more natural if we have that there. Like, look at the softening through there. And again, just kind of looking at, smile if you can. I know it's kind of hard to do because you got numbing. That's okay. I'm going to do a little bit of, again, using filler to give foundation. This will help us secure her height. There we go. Perfect. Okay, nice. And now, well, sorry, you guys. Very good. Okay, let's go over here. And we're going to do the same thing. So we're layering. She doesn't need that much, but very little blebs. And this will allow us to just soften the fold on the upper layers, because this is a smoother, thinner filler that can go more superficial and look very natural. And again, height and securing the height of her cheek. Look really pretty. Just evening, making it as even as the other side. Good. And that's basically what we're doing. What is this one for? Is this for, hold on. Just want to see something.
Dr. How often would I need a touch up of this type of treatment with fillers?
This would be yearly. If, obviously, if we're building it and you're just starting out, maybe you do this treatment first. Hold on. You would do this treatment partially, and then you give it 2 to 4 weeks. So what I'm looking at, I'm just looking at the height from various angles, making sure the cheek and the folds look really good. Does. My long-term plan for her would be maybe potentially just a little bit there, just to kind of give her more of that curve, and slight, if needed, temple, brow, under eye. Next step we're going to do is lifting. So let me show you. Can you come wipe again one more time? I'm going to wipe her, and we're going to do an Emer reveal really quick. It's obviously a little swollen, but still looks great. You can tell already. So let's give her the, let me give you the phone. Hold the phone for a second. Just kind of look like this. Hold that with your hand. No, hold it in your hand. Look right, like 45 degrees. What do you think? So a little bit more height, little less improvement in the eye, and I barely did anything in the eye and the folds. What do you think?
Yeah.
Now my goal with you now with the threads is we're going to make this lifted and more defined. And it just looks smoother, you know what I mean? So let me see. All right, so hold that. Give her the mirror really quick. I want her to see it in the mirror because it looks different. But it looks, honestly, I love it. Looks really good.
It's so good. Everyone's saying how good it looks.
It's good. All right, show her in the mirror. What do you think? It's high. It's a little high now, but it'll go down. But other than that, I love it. Okay, so you guys do a little pan. Show. Go ahead and take that. Do a little pan. Show how it looks, and then we'll start our threads. Perfect. I'm gonna wipe her real quick.